Hey everyone, this is Vivi. This afternoon, I just came back from rheumatologist office for my fibromyalgia, for my lower back and upper back pain. This rheumatologist is new to me because I changed my insurance plan this year. After 2 minutes of me talking about my medical history, he told me he doesn't manage fibromyalgia, so I have to find someone else. So while I was sitting in the doctor's office, very frustrated, I was thinking of 3 books I've read. So just want to do a quick vlog to share these 3 books. All 3 books are about opioid crisis. I will start with comparing these two, Dope Sick and Empire of Pain. Both books are great, but I personally like Dope Sick much better. If I had to use an analogy, Empire of Pain is more like a HBO show, and Dope Sick is more like a documentary. In an HBO show, there's typically a major storyline. There's a main character. In this book, the Sackler family is that main character, the biggest villain. In Dope Sick, I mean the book, not the TV show, not the Hulu show, because the Hulu show has to be like similar to the Empire of Pain. This book is more like a documentary. In a documentary, you're trying to interview different people, get different perspectives, and investigate, see where the stories intersect. I personally always prefer documentary over drama, like HBO show. In this book, I definitely think you can get more perspectives, like see the issue, opioid crisis from different lens. And this book, Empire of Pain, definitely does a brilliant job in terms of dramatic storytelling. Reading this book reminds me of exactly the HBO show, the Succession. This book is the Succession type storytelling. But I always had this urge to remind people who are interested in learning more about the opioid crisis in the US that Sackler family or the Purdue Pharma, which is a family business, can never ever create this opioid crisis alone. It was so refreshing to me when I read Dr. Macri in his book, The Price We Pay, which I mentioned in one of my previous videos. He said the US healthcare system, the billing and reimbursement, contributes to the opioid crisis as well. I was like, there you go. In the US today, most physician practices are still getting reimbursed by insurance plans through a mechanism called fee-for-service, which means physicians are reimbursed or the practices are making money from insurance companies based on number of patient visits. Of course, when they performed testing procedures on site, they can charge insurance company for that service, for that procedure, using a code called CPT code. However, under fee-for-service mechanism, there is definitely no incentive for a physician or the healthcare provider to spend more time with the patients to better understand the history, the concern, and do the counseling. Because more time you spend with one patient, it means less number of visits you get from other patients during a specific day. So this afternoon, I waited in the lobby and then in the waiting room for about 40 minutes. The rheumatologist came in and we talked for about 5 minutes and then he left. The only interaction we had was 5 minutes for me talking about what's going on, and then he telling me he doesn't manage fibromyalgia, and then he wrote a bunch of tests for me to do on site. Pain management is not a straightforward black and white topic, and no wonder it's just easier for physicians to interact with the patients for 5 minutes and just write the script. There is a time-based billing mechanism in place, which is called prolonged service or long visit. Not many payers or insurance plans allow time-based billing, and even if they do, the criteria are so stringent. For example, Medicare defines long visit as new patient visit over 89 minutes. This doesn't mean procedure operation. This means your face-to-face time, in-person time with the specialist or primary care in the outpatient physician office setting. Have you ever, or has anyone ever interacted with their provider for 89 minutes and over? I personally haven't. I guess what I'm trying to say is painting one single villain definitely makes a book much easier to read and make the show much more fun to watch. But in reality, the Sackler family cannot create the opioid crisis by themselves. The third book is Raising Lazarus, also by Beth Macy, so the same author of Dope Sick. In her second book, Raising Lazarus, Beth Macy took a step further. to propose potential solutions to end the opioid crisis. But something really sad was after this book was published, there came another new crisis. It's like OxyContin is displaced by something stronger, and you don't even need a prescription. You can just get the substance online. Alright, that's today's vlog. See ya.